Have you ever tried to say a word, but it came out sounding wrong, like saying thun instead of sun? Or do you know a child who people often can't understand when they talk? That could be a sign of speech sound disorder (SSD). It's not about being lazy or not trying hard. It's a real challenge where the brain and mouth don't work together perfectly to make clear sounds. Kids with SSD know what they want to say, but their words might sound jumbled or swapped. For example, a child might say wabbit instead of rabbit, even after most kids have learned the correct sound. Does this sound familiar? If yes, you're not alone, and the good news is it can be helped. So why does speech sound disorder happen? Think of it like a miscommunication between the brain and the mouth. The brain sends the message to say a sound, but the message gets a little mixed up. Some kids are born with it, and we don't always know why. But common causes include hearing problems, like frequent ear infections that make it hard to hear sounds clearly. Imagine trying to copy a song when the music player is fuzzy. You'd repeat the wrong notes. Also, some children may have mild delays in brain development that affect speech. Genetics can play a role too. If a parent or sibling had trouble with speech, the child might too. And in rare cases, a physical issue like a tongue tie, when the tongue is too tight under the mouth, can make certain sounds hard to make. But remember, SSD isn't caused by intelligence. Smart kids can have it too. How do you know if someone has speech sound disorder? Let's play a quick game. Say zipper, shoe, church, and yellow. Now imagine a 6-year-old saying zipper, shoe, tup for church, and well. That's not cute babbling anymore. It's a red flag. Kids with SSD often leave out sounds. Saying coo for school, swap sounds, saying thun for sun, or distort them, a slushy-sounding S. They might also simplify words, like saying nana for banana past age 4. These issues make it hard for others to understand them, which can lead to frustration, being teased, or even avoiding talking. Teachers might say, "He talks a lot, but I can't understand half of it." Does that ring a bell? The good news: SSD can be diagnosed and treated, and early help works best. First, a speech-language therapist, a speech doctor, will listen to how the child talks. They might ask them to name pictures, repeat words, or tell a story. They check which sounds are wrong and how bad it is. It's like a hearing and talking checkup. Then therapy starts. Fun, interactive sessions where kids play games while practicing sounds. For example, the therapist might use a mirror so the child can see how their mouth moves when saying SH, like a snake, or use bubbles to help control airflow. Parents are key too. They're taught how to help at home with quick, daily practice. Most kids improve a lot with 1 to 2 sessions a week over several months. There's no pill for SSD, but practice, patience, and play go a long way. Can we prevent speech sound disorder? While we can't stop all cases, especially genetic ones, we can reduce risks. First, protect hearing. Ear infections are common in young kids, but if left untreated, they can muffle sounds and slow speech learning. So, visit the doctor early if your child has frequent ear pain or hearing issues. Second, talk. Speak clearly to babies and toddlers. Read books together, sing songs, and repeat words slowly. When your child says tat for cat, don't correct harshly, just say it back correctly, yes, that's a cat. This is called mill-talking, gentle modeling. Limit screen time and encourage real conversations. Lastly, keep an eye on milestones. Most kids should say basic sounds like P, B, M, W by age 3, and trickier ones like R, L, S by age 7. If not, get a checkup. Prevention is all about early notice and support. Science is always moving forward, and SSD is no exception. Recent research shows that technology is helping kids learn faster. For example, some apps use fun games and speech recognition to give instant feedback, like a talking robot that says try again that sounded like dough, but we want go. Also, brain imaging studies are helping us see exactly how kids with SSD process sounds differently. This could lead to personalized therapy plans in the future. Another cool advance: some therapists now use teletherapy online sessions with great success, making help easier to reach, especially in rural areas. And studies are exploring how genetics affects speech, which might help predict risks early. The future: smarter, faster, and kinder, ways to help every child speak clearly.